Okay, we are here with Congressman Bill Pascrell, and he represents the 8th Congressional District in New Jersey. And I'm Eve, and I write on Daily Kos, and I work with Fire Dog Lake and Fire Dog Lake Action. And Congressman Pascrell has graciously agreed to give us a few minutes to talk about the public option. And he has been a champion and a great supporter of the public option. And Congressman Pascrell, I suppose I should ask you, today we're reading that Olympia Snowe might be in negotiations with the White House to come and join us in some fashion, and this would involve possibly a bill with triggers, which of course none of us support. So I'd like to know what your reading of all this is.
Well, from what I know of Olympia Snowe, in the 13 years I've served in the Congress, and reading about the senator before that, I think she's a genuine person. I think she looks to build bridges and not tear them down, as so many in this debate have attempted to do. I don't put her in that category. I really believe she would try to get something done. We saw how folks came forward, a few folks came forward in the stimulus debate, and who at the end supported the president. So the president can say that at least three Republicans supported that. At a time when you're in economic seizure, the federal government, you go back to the whole 20th century, every recession, there's always been capital investment, there's always been investment by the federal government, because nobody else is spending money. So I do not question her motivations whatsoever. I've said from the very beginning, in my support of a public plan, and it's the same now as it was then, that I've looked through all other options to bring religion to the quote-unquote, to the process of making the insurance companies finally live up to what they've talked about for 40 years. And I can find no other alternative but a public option which provides competition, which provides choice for everybody. And we're not taking any policy away from anyone. I mean, the lies that have been transferred during this period of time, particularly the last 4 months, has been incredible. But what she has to offer, Olympia Snowe, remains to be seen. I just read very briefly about what she was suggesting. I don't have any meat and potatoes to talk to you about, but I think that she's talked about making sure that the insurance companies do what they want. And don't forget, I'm a person who believes that the insurance companies should not be under the ERISA laws.
We agree with you on that.
And I personally believe that it's not enough to simply have state regulation of the insurance companies, and the results of that have been that in many states, one or two insurance companies have 50 to 60% of the insurance business. What in God's name does that have to do with competition? Just quite the reverse. So I'm anxious to see what she has to say. If there's a trigger down the road, I mean, if you look at the relationship between the Ways and Means bill and the Commerce bill, there are some differences. I think we can work those differences out. There are certain triggers in the Commerce bill. I think they were put in there to get votes to get the darn thing passed and out of that particular committee. So I'm anxious to see what she has to say. If you tell me that we won't have a public plan until we see how the insurance companies perform, well, that would have to, for me, that would have to be more than a day certain. I would need more meat and potatoes on the table.
Well, we love you for saying that, Congressman Pascrell, because now you're bringing me to my next question, which is, will you commit to not voting for a bill if it does not have a strong public option available on day one, no triggers, and no co-ops? That's what we hope you will do. You'll stand with Congressman Nadler, Congressman Waters, Congressman Yvette Clarke made one of the strongest statements to date. She pledged repeatedly that even if President Obama brought her to the White House and asked her to vote for a bill that didn't have a public option, she would say respectfully, Mr. President, we need a public option to keep the insurance industry honest and to bring down costs. So would you also commit to not voting for a bill if it doesn't have a public option available to all Americans on day one, and make this commitment right through conference?
Well, I support my president. I belong to the Democratic Party. I spent a lot of effort, provided a lot of effort to get Barack Obama elected president of the United States. Now, I could criticize a lot of things that he's done since this issue became part of the public agenda 3 months ago. I know what he said during the campaign. He cannot fail on this issue because not only does it bring up what happened in 1993 and 1994, he has to have a victory on this since he committed so much of his election campaign ammunition to this effort. So having said that, I want him to succeed. Number two, I want health care change. I want insurance reform. I refer to this more as insurance reform because if we don't have that, we're not going to have anything. Someone comes up with a suggestion that lays out tangibly how insurance reform is going to affect the changes that I would want to see, that is universal health care right now, a containment of costs, number two, and number three, addressing the chronic illnesses that affect America and get into the question of prevention. Even if there was a public plan, I wouldn't support that either. I'm more concerned about more so what you call things. No, I'm more concerned about what substantially is in a particular piece of legislation, and that's why I voted for the Ways and Means bill without any equivocation.
Congressman Pascrell, before I came up to your office, I walked around Paterson a bit, and it looks like a community that really needs a public option available to them on day one. So I'm asking you again, I think your constituents in the 8th Congressional District need a public option, and we're hoping and asking you to pledge to stand with other Democrats strongly and be very firm and commit right now to voting against any bill right through conference if it doesn't have a public option. Doing this for the people of Paterson and the people of the 8th Congressional District.
I've explained to my district and I've explained to the people of Paterson. I've lived here all my life. I was the mayor of this community. I know the community knows me. I don't talk out of both sides of my mouth. There'll be 77,000 people in my district who will be eligible for health care if this legislation goes through. I will not vote for any legislation that is 76,000 covered. The point I'm trying to make is I'm more interested in the coverage than what you call something, because all of us on all sides of this issue, and it's not just two-sided issue, as we've found out in our own party, I personally believe, regardless of what you call something, and I'm perfectly comfortable to call it a public option, as long as those folks are covered, as long as we have cost containment, as long as we move against the chronic diseases and prevention of them, and as long as we reform the insurance business, I can support that.
Okay, and I'd like to ask you one more thing. I'll probably be in Washington next week, and maybe we can follow up with Paul, your wonderful communications director. And
the door is always open.
Oh, you're to Fire Dog Lake and Eve and Jane, and just see how things are shaping up, and hopefully have another conversation with you.
We've spent 70 hours in the Ways and Means Committee looking at this issue. And then we spent the full day and evening up until 2 o'clock in the morning, leaving the hearing room only for votes, marking up the bill. I have read the bill. I'm happy to say. Some may say get a life, but I think it was important for me. But this is like Social Security. This is like Medicare, Medicaid. This is just as important to the American public. And I'm glad I did that. I helped write certain parts of the bill on continuation of health care, on the workforce legislation. I've been a strong advocate of that. So I know what's in the bill. I know that it takes two to tango, that the business of legislating is compromise, but I will not compromise universal health care.
Great. Thank you very much.